Hello everyone, welcome to my YouTube channel Pharmacy Way. Today I am going to explain you the dose measurement. So let's start with the definition of dose measurement. It includes measuring the dose of a drug with the help of measuring devices. In the institutional settings, doses are measured and they are administered by professional personnel. A variety of measuring devices may be used. It includes the calibrated cups and syringe and intravenous set, IV sets. Calibrated cups are used to measure oral liquids, and this syringe and IV sets are for the parenteral medications. Now next is liquid dosage. They are usually measured in a household terms. So these household terms are teaspoonful, which is abbreviated as small tsp, or tablespoonful, which is abbreviated as capital TBS, or you can also write small tbs. So these are the household terms which is used to measure the liquid dosage. Oral dispensers are also used in administering the calibrated quantity of the liquid medication to the children. So you can see the picture of oral dispenser which is used to administer the medication to the children. As you can see in this table shows the selected route of administrations and their representative dosage forms. The left column, it shows the route of administrations, and the right column shows their representative dosage form. For example, for the oral route, the representative dosage form is tablet, capsule, solution, drops, syrup, suspension, etc. For sublingual route, the representative dosage form is tablet. So these are all route of administrations and their representative dosage form. Now the next is teaspoonful and tablespoonful. So teaspoon, it is abbreviated as small tsp, and tablespoon, it is abbreviated as capital TBS or small TBS. In calculating doses, the pharmacist and physician, they accept a quantity of 5 ml for 1 teaspoon and 15 ml for 1 tablespoonful. It should also be noted that the capacity of household teaspoonful and tablespoonful is, for teaspoonful it is 3 to 7 ml, and for tablespoonful the capacity is 15 to 22 ml. There are some factors like viscosity, surface tension, and the technique of the person measuring the liquid. These three factors are influences the actual volume which is held by a household spoon. USB, that is United States Pharmacopeia. So according to this USB, for household purposes, an American standard teaspoon has been established by American National Standard Institute, as it is contained according to them 4.93 plus minus 0.24 ml. In view of the almost universal practice of using teaspoon ordinarily, which is available in the household for administering of medicine, the teaspoon they may be regarded as representing 5 ml. Okay, so preparations which is intended for administered by teaspoon, it should be formulated on the basis of the dosage in 5 ml unit. Any dropper and syringe and medicine cup and any special spoon or any other device. So these all are used to administer the liquid should deliver the 5 ml wherever a teaspoon calibration is indicated. In general, the pharmaceutical manufacturers they use 5 ml for the teaspoonful and 15 ml for the tablespoonful for the formulation of oral liquid preparations. Now next is drop as a unit of measure. It is abbreviated as GTT. Okay, and this drop it is used to measure for small volume of liquid medication. A drop does not represent a definite quantity because drop of different liquid they vary. And in an attempt to standardize the drop as a unit of volume, the United States Pharmacopeia they defines the official medicine dropper. So the United States Pharmacopeia they constructed the official medicine dropper at how they are constructed this. It should be a round opening having an external diameter 3 mm. Okay, and the dropper which is when you will held it vertically it will deliver the water in a drops. Each of the drops weight about 45 to 55 mg. So according to this, the official dropper is calibrated to deliver approximately 20 drops of the water per milliliter. So if you are saying 1 ml of the water, it is approximately deliver the 20 drops. It should be kept in your mind that few medicinal liquids have the same surface and flow characteristics as like the water. Therefore, the size of the drops it will vary from one liquid to the another liquid. The drop should not be used as a measure for a specific liquid medication until the volume that the drop represent has been determined for that liquid. So this determination it is actually made by a calibrating the dispensing dropper. Let's understand that calibrated dropper. Calibrated dropper is the only one that should be used for the measurement of medicine. Most manufacturers they include a special calibrated dropper along with their package for use by patient in measuring dosage. Specially calibrated droppers are shown in this figure. Now the next is a dropper can be calibrated by counting the drops of a liquid as they fall into a graduate until the measuring volume is obtained. So number of drops per unit volume is then established. Let's understand this within an example. So the example is, if a pharmacist counted 40 drops of a medication in filling a graduate cylinder to the 2.5 ml mark, how many drops per milliliter did the dropper deliver? In this question, the pharmacist counted 40 drops, which is filling into a graduated cylinder from the 2.5 ml mark of the liquid. So we have to calculate it out the drops per ml. So the 2.5 ml deliver 40 drops in a graduated cylinder. So how many drops it will come when we are talking about 1 ml? For 1 ml, how many drops will deliver? For that, we have to calculate the value of x. When you are having any two equation, you have to just divide the both equation. So 2.5 divided by 1, it is equal to 40 divided by x. And by this way, you will get the value of x. So the x will be 40 divided by 2.5. Okay. When you will remove the decimal from this 2.5, it will come the 10 up, because after decimal we have only one number. So that's why only one zero will come. Okay. So now we have 40 divided by 25 multiply 10. Then what is the answer? It is the 16. So 16 drops per ml. So for 2.5 ml, it will deliver the 40 drops, and for if you are talking about 1 ml, 1 ml will deliver the 16 drops. Okay. So this is all about the concept of dose measurement. I have some learning assessment questions for you. So it is here. You can solve it and you can write your answer in comment box. Stay tuned for next video and do like, share and subscribe.